Internship review. Well, considering the topic of this video, you guys must be wondering why I haven't changed my clothes since the last video. Well, I'm making 2 videos in a day. What a surprise! Anyways, so let's talk about my perspectives on the postings that I have covered as of yet, about 5 months into my internship. So yes, surgery review. So surgery was the first subject that I was, or the first department that I was posted into. I was posted in the ward of a rather well-known professor, the sort of professor that patients come to be treated by. And so yeah, we had hefty workload, and I was really happy that I got that particular unit. So day one I go there, and it was our OT day, so we had to change. Like as soon as I was assigned the unit, I had to go change into my scrubs and enter OT because it was the OT day. And I was greeted by JRs who were really pining for us because there was a 2-3 week gap where they had no interns because there was some discrepancy between the last batch and ours. So I was greeted by my JRs and they were super nice, super nice. And I had a really fun time in the OT, and then came back to the ward, met my JR2, and we worked on some stuff. I think I was shown how to insert my first insert an RT and insert a Foley's, and then I had to do some paperwork, and that was that. So we have opted for 12-hour shifts, and that was easier on us. We'd get more time off that way rather than working for 6 hours. So more time off together altogether. So yeah, it was heavy, not going to lie. The 12-hour shifts were a little brutal. We'd get 2 people working at a time, and we'd get a lunch break, where one person is working and the other one goes and has lunch. I was initially intimidated by the prospects of drawing blood, and that is because like if you've had patients in your family, you'd realize even if they went to private practices, I am actually not very sure, because I have been very fortunate in that regard that I personally did not have to go to a hospital or get admitted to a hospital. But that sometimes the nurses or the doctors, whoever draws blood, I don't think they have phlebotomists, but whatever. Yes, they make mistakes, and they end up disrupting the vein, piercing the vein and causing that swelling and the discoloration. So I had that thing in my mind that, oh, I hope I don't cause that, and oh, I don't want to do this. I am a little worried. That has been my approach with with a lot of things, but it is something that I'm learning, that you need to start things with confidence, and the things that I did start with confidence, they did bear fruit. This unnecessary critique before you start doing things, I feel that becomes a huge barrier, rather than you protecting your parents patients. You'd whenever you'll try with with that lack of confidence, not only will you harm your patients, you'll also reduce your own confidence in doing that particular thing. So yes, be confident, enter the vein at a slight angle, then go a little horizontal. That is what I eventually learned. Anyways, so yeah, uh, that was a huge thing. Other than that, I would say surgery was okay. I loved working in the OPD. Was a really nice time, because we were sitting with the professors and we got to see things. Of course, um, you know we had to examine things, and that was something that I really liked, working in the surgery OPD. I have always been more of a more of an OPD person, so I really enjoyed working there. Then there were OT days. I think only in the last OT day did I get to really participate, like to like scrub in. I am not the sort of person who bothers people. Oh, I really want to do this. I really want to do this. I feel that I wanted to be tested. I wanted to be sure that, okay, um, like I wanted to develop my skills enough to maintain a sterile field and to assist doctors. So yes, I got to assist, not to do anything really specifically, just to touch the patient and hold the patient in place and all that. So yeah, it was fun. It was something that gave me relief that, oh, at least I assisted in one procedure. Yes. Then we had emergency days. Emergencies were like 24-hour period, 8 a.m. to the next 8 a.m. Where you're handling all the new patients that were coming in. And yes, we had 12-hour shifts on those days also. So the guys who work the morning shift would also end up working the next morning, but the guys who would work the night would get the next day off. Nights were particularly hectic. So yeah, I got to practice suturing. Wasn't too good at it initially, but got better. And um, I feel the main thing that I would focus on is, please make sure that you have everything to protect yourself. And by everything, I do mean everything. Have glasses or protective eyewear, wear masks, and wear gloves. I feel like I have been in all three situations where I was exposed in these particular areas. And I I would say I already am very uh, I wouldn't say a germaphobe, but a sort of person who really uh, puts emphasis on not getting exposed and not getting sick. Like I always carry some liquid soap with me. I also carry paper strips. I also always have hand sanitizer with me. But this sort of protection that I wear, mask and gloves can give you, nothing beats that. So yeah, yeah, just I get it. Like in a government hospital, being an intern, your access to such supplies is limited. But please make sure that you are protected always, and please wear a coat. And because surgery has gross stuff, and the sort of environment that I'm in, we have a lot of infective patients, sort of with the sort of infections that you can't get rid of. So yeah, just be really safe, and your coats will protect you. Don't try to be a fashionista. uh, One, because your clothes might get ruined. Second, your clothes might not protect your forearm and other parts of your body, so be mindful of that. And I ended up buying this one particular detergent. I'll show you. So I bought this particular detergent. It's Savlon Soft and Protect. So yeah, it has some antibiotic action. I think I am not sure what how it does what it does, and can I rely on it or not? But it does give me some peace of mind. So yeah, it is something like my emergency clothes. As soon as I enter my room, they will not go anywhere close to my clean clothes. They will not go anywhere close to my bed. They get washed straight up. So yes, uh, protect yourself from infections. Wear masks because well, 1 in 4 people have tuberculosis. So yeah, well, that was surgery. Then I had anesthesia. The one thing that I really need to talk about in surgery before I start talking about anesthesia is that I had surgery for 6 or 7 weeks where um, I really became part of that ward. I really enjoyed getting um, you know, familiar with the patients, uh, developed a bond with my JRs, JR1s and JR2s and JR3s, the SRs. It felt that I belonged there. And that sort of belonging, whether it was created artificially by my JRs to extract work out of me, because that is also a thing, and I'm not accusing them of anything. I am the sort of person who will give you a clean chit on most, in most situations. And yes, I don't believe that they were artificially good to me, but even if they were, uh, that's a good thing because I felt that I belonged there and I did feel like going beyond the call of duty to work. Um, so yeah, coming on to my second posting, which was ICU and anesthesia. Had the anesthesia posting first, did not have a lot of things to do. We've just observed patients being given anesthesia during surgeries and pre-anesthetic checkups and all that. ICU posting was where I felt a huge disconnect. I only had a week of ICU posting, and since we have plenty of interns, I did not have too many shifts in the ICU. And every time I went there, there were some different JR1, JR2, JR3. So I wasn't really developing a bond with anyone. I wasn't building up a bond with my JRs, not with my the patients that were there. And that was one particular place where I felt that I was exploited and, yes, to be very honest, exploited and not really appreciated for what I brought to the table. But that is how things are. Then I had my radio like elective postings, which was radiology. Radiology was a cakewalk, nothing to do. I observed, like, out of my own curiosity, tried to observe CTs and ultrasounds and everything like that. But I also was studying whenever I got time during the posting hours. Mm. Then I had orthopedics. I personally have I have stereotyped orthopedics in my mind because, frankly, like, it's the memes that we see and the uh, the infamy that this branch gains by being a boys' club. Um, I was not excited to join orthopedics. I got the heaviest unit, and I did work there. And to my surprise, it wasn't as bad as I thought it was going to be. I survived, and um, while the allegations are true, uh, the Ortho JRs were pretty nice. Uh, I had a lot of meals that were sponsored by them, so yeah, thank you. um, so yeah, Ortho went by. Uh, would I like to ever have ortho, like, because I'll have an elective later in the year where I need to join either medicine, Paeds, surgery, ortho, or gynae. I will not choose ortho. So yeah, then I had my medicine posting, which just recently ended. So medicine, I was really worried. because I got the oh well, there was also that anticipation of getting like which unit will I get, because there are some particular units where you don't get to select your you don't get to make your own roster. So I like knowing when I have days off, and I like scheduling my days off or hours off or whatever, just so I can have time to do other things in my life. I feel that is very important to me. My work life balance is very, very important to me, and being able to be with my family is also very important to me. So, yeah, I was very worried, but then I got the best unit, and the best unit with the best professors, and the one with one more intern. So, yeah, slightly less workload, and it was good. It was really, really good. Because in the other postings, I did have the opportunity of maybe asking my JRs that, oh, I wasn't able to draw blood correctly, or there was some other issue. No, I just had to make it work. And the insights and the techniques that were taught to me in this posting really, really helped. And now I don't think that I have failed to draw blood ever since. The medicine JRs, they helped me improve my technique and all. And now I'm really confident. So yeah, that was good. I really, really worked, and um, I tried to keep a happy face while doing that. So the JRs were also happy with me. I'm also very lucky. I'm not going to lie. Sometimes just luck works out in my favor. So I had a pretty good impression on my JRs, and I worked well. I know that I gave my 100%, and I'm very happy with that. And in the end, uh, like I felt appreciated for the very first time uh, in my college, because throughout these 4 years, I I might not have been the best, but I know that I always played by the rules, did things how they were meant to be done, and finally my work ethic was appreciated. Uh, as I was receiving my completion, I was appreciated by a professor I really, really respect. And to be very honest, in my own mind, I feel that I feel that I received a huge, huge validation, and now I want to be better. I just want to make sure that I make that professor proud again in the future. I want to work hard. I want to show that his appreciation of me was not something that I did not deserve. So yeah, I feel extremely motivated by that fact, and yeah, I'm actually quite happy. And that if Tanmay in my first year, second year, third year would hear that, oh, that you're happy in this college, you're being appreciated. Those versions of me would be really, really surprised, shocked, I might say. So yeah, currently in my Paeds posting, and I'm really enjoying it. I am trying to bring my again my work ethics. I feel my work ethic is good, and I'm trying to bring that and present that in my unit, and I'm learning a lot. I have unfortunately seen untimely deaths, and I understand how sensitive things are, and I'm learning a lot that way. I think in adult medicine you do have a lot of leeway, before things go wrong, and that is And I feel that if you have clinical like acumen accumulated over years and years, yes, you would know what to do. But in pediatrics, unfortunately, uh, you know, I have seen things happen. I've seen misfortunes strike a lot of parents. So I have retrospectively learned how, you know, how things could have gone wrong, how one misstep can end up costing you dearly. So I feel that my like these are the sort of things that will stay with me forever. And you know, and this is what I'll ensure that never happens uh, when you know the responsibility is on me. So yeah, I am learning quite a lot in my pediatrics posting. I feel like my clinical acumen is really like I developed my clinical skills in you know procedural skills in my medicine posting. I feel my knowledge is being increased overall in pediatrics posting. So yes, I am quite happy. I'm surprised that I'm happy, but I am very happy. So that's a change. So yeah, that's all. That's a really long review of you know just 5 months of my internship. I really don't know how to condense my feelings or you know speak uh, a little fast. I know I speak a little slow. So if you went through the entire video, I thank you, and I hope that you enjoyed the video. Please like, share, subscribe. My subscribers aren't growing. While I don't take that personally, I would really like to see some change. So yeah, regardless of that, there'll be more videos in the future. Thanks for watching. Bye bye.